Hello, and welcome back to Think Yourself Healthy podcast. I'm your host, Heather Barbieri. Before we dive into this episode, I just want to remind you that if you take a screenshot that you're listening and tag us on Instagram, we'll send you a 15% off discount for the 8-week Retrain Your Brain program. Just take a screenshot and tag me at Heather Barbieri RDN. Thanks for listening, and let's get right to it. Hello, everybody. On today's episode of Think Yourself Healthy, I have special guest, Dr. Jolene Brighten. She is a board-certified naturopath endocrinologist, a clinical sexologist, and prominent leader in women's medicine. A fierce patient advocate and completely dedicated to uncovering the root causes of hormonal imbalances. Dr. Brighten empowers women worldwide to take control of their health and their hormones. She is an international speaker, clinical educator, medical advisor with the tech community, and considered a leading authority on women's health. And we can also add author to that list of accolades now. Congratulations. Dr. Brighten, thank you so much for being here.
I appreciate it. Yeah, I'm looking forward to chatting.
Me too. Well, I'm really excited about this book release that you have coming out in April. So the title of the book is This Normal? And I know that for many women, we have a plethora of questions around our women's health and whether or not something is normal. So I'm excited to have you here today to chat all about these abnormal things and how we can get them more normalized. So thank you for being here.
Yeah, well, let's dive in.
Yeah, so I'm really curious to hear your perspective of how I get myself out of the hole I have dropped into post getting COVID in 2021. So I ended up getting COVID, and then a couple months after that, I started having massive problems. GI distress, lots of bloating, abdominal discomfort, went into SIBO. Hashimoto's is back, anemia is back, vitamin D is at 11. I cannot get that back into a normalized. So just this whole domino of things that occurred post getting sick with having COVID. So I'm curious to hear your perspective of what the root causes that has created all of these issues that have led me into full-blown menopause.
Yeah, well, I would love to be like, this is exactly what's going on, but I'm not your doctor,
right?
And I don't have access to your labs. Plus, I would spend like a good 90 minutes going through your history and understanding what does it look like for your lifetime, not just the moment that you got COVID, but what you've identified is really important. Like, this is a triggering event that has led to a plethora of symptoms, diagnosable conditions, and including you going into menopause. So menopause is something I think it's really important for everyone to understand that starting at 45, it is considered normal to go into menopause. We like to go back and be like, okay, well, what was your mother and your grandmother's menopause like? And if they were going through menopause at 50, 52, then 45, that's not what we would have expected. And you're saying 46. And so that's not an abnormal time for the ovaries to want to call it quits. But from what you're saying is it sounds like it happened sooner than you expected. So what I'm curious is that previous to having COVID, what were your periods like?
So they were perfect. I used to tout, and brag about how for early 40s, how unusual I was compared to all of my girlfriends who either were already in menopause, having the horrific periods, the fibroids, you name it, all of the things. And I was very fortunate that I did not have any of those issues. I had very regulated, I wouldn't even know I had a period other than just having the menstruation each month. Other than that, it was perfect. It was amazing. And then it changed.
And were your cycles every 28 days, every 30 days?
Yeah, so they would be between 28 and 30 days for the most part. And I have tracked for probably the last decade. So I had a really good history recording any kind of symptoms that were abnormal. And for the most part, I didn't have any of those. So anyway, about a couple months after getting COVID, then all of a sudden the things started to change. I started having excessive swelling and fluid retention leading up to my period, extreme cramping, really sore and lumpy breast, massive hot flashes, insomnia, like insane insomnia, appetite changes, energy changes, and excessively heavy bleeding with lots of clotting. So it went from one extreme to the other.
Mm-hmm. And how long did you have COVID for? Was it like the, typical get COVID, over it in 10 to 14 days?
I got COVID and I had 104 fever for 14 days straight before I came out of that fever state. And then after that, it was a very slow recovery process of just getting back into a more normalized state. I would say it took at least a month before I could resume any kind of normal activity. So I'd say it was a good 6 weeks that I was really significantly impacted.
Mm-hmm. And then was your period gone? Like, was it, you said like, a couple months later, everything started to change. Was your period gone within 3 months, within 6 months?
I would say within 3 months is when the significant changes started. And then by 8 months, there was the lapse, the issues, having the massive
and then how long
legs. Yeah. So I'm still.
And how long has it been without a period?
So I'm still.
Like, has it been 12 months?
No, not at all. So I guess that puts me in that perimenopausal state. Is that?
Yeah.
Okay.
Yeah. So menopause, the diagnosis of menopause is the day that has been 12 consecutive months with no period. When you hit that day, you are menopausal. When you come into the next day, you're postmenopausal. So to be menopausal means absence of menstruation for a year and meeting a specific age criteria. As we talked about at the beginning of this, sometimes people are like, I'm menopausal and they're 29. And like, you can't be menopausal because menopause is a natural state in which the ovaries, they stop making hormones. That's totally normal. But to have that happen before age 45 is not considered normal. So it does sound like perimenopause, and that unfortunately is normal. Because I say unfortunately because it sounds like you're dealing with a lot, but that is considered normal at 46. So perimenopause can start roughly a decade before our period stops. So if 45 could be menopause, then 35, you could be starting perimenopause. And unfortunately, many people will go through this for a decade, struggling with hot flashes, anxiety, sleepless nights, breast tenderness, a lot of the fluid changes, everything that you talked about. So it may be that was waiting in the wings and that was going to happen anyways. And it was coincidental with COVID, right? That could happen. It may also be that, because you also said that you have Hashimoto's. So everyone's on the same page with us. Hashimoto's is an autoimmune condition that affects the thyroid. And with that condition, your thyroid gland gets destroyed and you're not able to make sufficient thyroid hormone. Now, there's a whole lot we don't know about COVID. And a lot of what we base things on are based what we know about other viruses and about getting sick. And we know that illnesses or anything that gets that immune system upregulated, that can be a triggering event for the onset of an autoimmune condition, or it can make an autoimmune condition worse. Now, why this is important to the whole talk about our cycle, because most doctors you talk to will be like, the thyroid's up here and the ovaries are down here and they are totally separate. But in reality, you need you need your thyroid hormone to stimulate the follicles in the ovaries to get mature. So they're part of that whole picture, and to have regular ovulation. What is perimenopause? It is the decline of ovarian function, not the quit. There's not quitting yet, but it's that decline of ovarian function. And when you can see ovulatory cycles become less regular, now we've got these irregular periods, or we still ovulate, but we can't produce that progesterone. And so now we're having a lot of those symptoms which appear as an estrogen dominance. And it's usually that estrogen's fine. We just don't have progesterone, putting estrogen in check. So it's important to understand how all of those things are connected. So, and I do want to say that COVID has been very interesting because we know the immune system is connected to the uterus. How well and how exactly, we don't totally know because we don't do a ton of research in women's medicine. And I'm hoping, post-COVID world, that changes because as we saw when that vaccine came out, a lot of women reported changes in their menstrual cycle. Unfortunately, a lot of them were being gaslit online by a lot of providers now who are now being like, yeah, of course this happens. But at the time, they were making sure that women knew just how dumb doctors thought they were. Not all doctors, okay? I did not think this, but there were a lot of doctors that I saw saying that. And I'm like, hold up. Like, it is normal to have a severe illness of any kind or a viral illness and see that your periods become irregular. When they come back, they're really heavy. Like, why would our periods become irregular? Because if your body is like, the environment's not safe, it is not time to ovulate, it's not time to have a baby. Okay. So your body's like, let's stay safe, put all of our energy into survival and not into reproductive health. That's very, very expensive. So in ovulatory cycles, that would be normal. And they usually resume within a month or two, sometimes 3. If it's 3 or more, we want to see a doctor because that's something else going on. And we want to make sure that we are ruling those things out. But if you're not ovulating, then you're not making progesterone. It's the only way you can make progesterone. If you're not making progesterone, there is nothing there to oppose estrogen. Estrogen, lovely hormone until it's not, but it stimulates the endometrial lining to proliferate, to grow. And so what happens is that you have this period of time where estrogen is stimulating the uterus, but you never have that progesterone and then that drop in progesterone to trigger a menstrual cycle. So when you do get a period, it is clotty and it is heavy. And it should be clotty because we form clots when we are bleeding. And if you're having a whole lot of bleeding, then your body's going to really try to form clots. Small clots in general are normal. Large clots, when you've gone a long period of time not having a period, we would also expect to see that. Consistently large clots every period, that is not normal. So there's that other connection of like, okay, you can lose your period if you get sick. You can lose your period if you get COVID. You can also lose your period if you get the COVID vaccine for a period of time. And once we got that research that came out where they were like, yeah, we never thought to check that until like 50,000+ women were like, hey, something's up with my period. And it makes sense. It was not a surprise. I think it was a surprise when you bring a new vaccine in to the population with a new novel virus. I mean, everything was freaking scary, right? For like the last 2 years. People right away were like, the vaccine's causing infertility. The vaccine's causing all these problems. And in reality, from what we've seen, the vaccine is on par with COVID in terms of seeing like, menstrual cycle changes. And we do expect that anything that elicits an immune response can change uterine function, can change ovulation. If you change those things, you change periods. So does that all make sense? Like what I'm talking about?
Oh, absolutely. And it triggers the question, of was this inflammatory induced or was this actually perceived stress induced that, created a decline in progesterone. So I'm curious as to how the actual stress response plays into the root of that.
Okay, so that's a great question. Inflammation is a stressor. So I think that's a really important thing to understand. And really, like when we define stressors, they're things that are going to mount a response from the adrenal glands. They're going to demand a response from the adrenal glands. And we all think about cortisol as a stress hormone, but it's also anti-inflammatory hormone. So it's going to keep inflammation in check. Now, if that body, if your body or my body, any body is perceiving stress in the environment, there's lots of inflammation, things like that going on, you are going to have, basically the mitochondria are really like some of the key players in orchestrating all of this. Your ovaries are really rich with mitochondria. And you're going to have the whole body say, well, let's do this cortisol thing, less of this progesterone thing, none of this ovulation thing. And at the same time, as you have inflammation up, you're going to upregulate an enzyme called aromatase, which is going to take your testosterone, convert it into estrogen. Now we have even more estrogen. And, when you have increased estrogen, you can see more inflammation arise from that because that can interplay with the adipocytes, so the fat cells, which then create more inflammatory proteins. And now cortisol is like, wait, like we've got to get ahead of that. And on top of that, an autoimmune condition, and you are already like simmering a fire, right? And even, so I have Hashimoto's. We have a lot in common in all of this. So I actually had COVID. I had COVID in early 2020, and then I developed long haulers. I actually spent 4 months on oxygen at home. Wow. And at the time, I was having, so I never had a cough And I didn't have a fever initially. Actually went to the emergency room because I was short of breath and just couldn't breathe. And my pulse ox levels, I didn't have oxygen in my blood the way that I should. And yet my x-ray, my CT scan, my lungs were clear and I didn't have the stereotypical respiratory symptoms. And most of my symptoms were neurological. So I had a lot of people at the time telling me that I was like making up stuff. Long haulers wasn't even a thing that was defined. I was like, what is freaking wrong with me? Because I can't get out of bed. I can't breathe. My pulse ox was scary. It was in the 70s sometimes if I wasn't on oxygen. And so there were all these, like, it was very funny because in the conventional world, all of these doctors were like, you're making it up. COVID only has respiratory symptoms. Oh, you can't be having neurological stuff. It's something else. Oh, you just are like seeking attention, malingering. Okay. Then I have the like wellness community that's like, no, only people with diabetes or cardiovascular disease get COVID and get like they weren't saying long haulers at the time, but get this sick. So this doesn't make any sense for you. And here's the thing that was true for me. I had set out to travel the world in 2020. It had just been February. We were leaving in a month for Italy. I had just went to Puerto Rico in February. We were going to be leaving to Italy in April. Nobody went to Italy in April. I still haven't made it to Italy. But I had done a full panel and worked myself up at that time because I'm like, if you're going to travel the world, you best know, do you have any cardiovascular risk? Like, what is your, what are your lipids? What does my thyroid look like? I remember doing a Dutch test. And for the first time since the Dutch test came out, I had great cortisol levels. I was like, how did I achieve this? How did I finally achieve like this picture of adrenal health? And I was so proud of myself. And my Hashimoto's is in remission. I don't see any antibodies. But then I get super, super sick with COVID. Well, this is where I'm like, you are already simmering, right? Even though my Hashimoto's was it was non-existent. You couldn't diagnose me with it because my thyroid looks great in terms of the panel, and I didn't have antibodies. So this is where people would be like, oh, you're cured. It's not cure, it's remission. And why that's important is that if you think about a burner on a stove, it's like having it turned on low, right? Like it's really, really low, but you haven't put the pilot light out. Okay. It's there. So you always have the capacity to turn it up. And that's really what COVID can do. And really any infection can do that. And I think, Dr. Jatis Karazian, who is brilliant. If anyone has thyroid disease, you definitely seek that man out. I trained under him. I love him. He was saying very early on when I was developed long haulers and was having issues, he was showing research that COVID was activating autoimmune conditions. And at that point, it reinforced what I was saying silently to like my inner circle of people of like, I think I'm so sick because I have autoimmunity. I didn't get a fever. My body didn't sound the alarm to this. So this little freaking bugger of a virus got to replicate in my cells. And by the time my body caught on to it, there was already cellular damage, like in my epithelium of my blood vessels. So I couldn't transport oxygen and all of these other issues going on. And so what we've now come to find out is that there are some autoimmunity to the immune cells that actually would sound the alarm being turned on by COVID. But it's important for people to understand that, COVID potentially could trigger the onset of a new autoimmune disease, or it can make one you already have worse. And when you're in a situation like I was, where you're just like I was having trigeminal neuralgia, I was having wandering shooting pains throughout my body. I was having, there was time where I recognized that I was starting to have a distorted reality. Like I wasn't sure what was dream and what was real. And then there was all the static, is what I call it, of social media that I actually just like pulled back, and I was like, take all the devices from me to my husband. And I actually really haven't been back to Facebook since. I just like bounced out of everything because I was like, my neurological health is suffering, and yet there is all this stress in the world right now. So, with all of that, I did end up measuring, eventually finding my thyroid antibodies went up again, was able to put those back into remission. And anyhow, I'm just sharing my whole story with you because I think it's a great example to understand a lot of this framework. And in reality, like, I mean, when I did my labs, I was like, what was I, like 38 at the time? And talking with my doctor, and they were like, I would think you were in your 20s. Like, your labs look phenomenal. I was like, I know. This is the healthiest I've ever been. Literally words that came out of my mouth, and then boom, COVID, long haulers. Like, what the hell? And then when you're hearing just everybody being like, oh, you have to have like concomitant, morbidities, and like you have all these other diseases. And I'm like, but that's not me. And this doesn't make sense.
No, your story is so relatable. And I appreciate you taking the time to walk us through that. So oddly, similar to you, in April of 2020, I too was supposed to set out and travel Europe and experience all the things.
Why was everybody doing that?
I don't know. It was really unfortunate. And I myself have yet to make it to Italy. I did marry an Italian in October of last year. So that's secured, hopefully.
Okay, that counts. It's one step, right?
But let's hope. But back to all of that. So for me, in 1994, I got diagnosed with IgA nephropathy, told I have 5 years to live, and that there was nothing I could do to change that prognosis. And at that time, I wasn't a full-time student, got kicked off my parents' health insurance, and then couldn't get health insurance for having a pre-existing condition. So this was a very pivotal
That is the
moment.
privilege of the U.S. healthcare right there, right?
Yes. Well, actually, it was such a blessing in disguise because for me at this time, I didn't have access to the Western system. I had to seek solutions outside the box, and that introduced me to holistic functional Eastern medicine, which ultimately put all of my circumstances into remission. And I bought 28 quality years on my life. And then I get COVID, and then it takes everything. I went into stage 3 kidney failure, post-COVID, all of the things, long haulers, you name it. So it's been an interesting journey. And I'm curious, as a health professional yourself, going through this personally, was there any frustration around how is all of this happening to me despite my level of knowledge and understanding and knowing what kind of interventions to take? Did that create any conflict for you personally?
Yeah, that's a great question. And nobody's really asked me that. I think that anytime we struggle with health issues as practitioners, there is this like propensity to be like, I have all this knowledge and like, why can't I like prevent this? And like, you wonder these things, and then you remind yourself that like, we're human, we're actually really fragile. Like the fact that like we exist as a species is like really astounding. But when I went to the emergency room, and like what treatment options did they have for me when my lungs are totally clear? They're not going to intubate me. Like that's not going to happen. My lungs are not the problem, but they don't know what the problem is. They don't even know how to do. And I actually had a conversation with my doctor. They were all wonderful. I was like on buckets of supplements because I was just like, I don't know what this is. And the doctor like told the nurse, like, help her take her supplements because like, we don't know. Like, and I have to just say, like, my doctors were really great in that way. And when I said to them, like, my problem is oxygen, can I just, because what they said to me is that if you stay here, you're going to deteriorate. Like you absolutely are, because at the time it was so early, barely anyone was spending time in so this little COVID room off in the way far off from the hospital, no sheets on the bed, nobody's bringing you water, no one's bringing you food. Like they hooked me up on an IV and just basically like called it a day. And then they spent very little contact with you, right? Because it's like scary, like nobody wants that.
Right.
And so they were right. I would absolutely deteriorate. They were like, if you're not in your own bed and eating your own food, like you are going to deteriorate rapidly. So we need to send you home. And I was like, can I go home with oxygen? And they were like, absolutely, let's send you home with oxygen. And so when I left there, they basically as soon as they had the positive for COVID, so they got a positive for COVID, they were trying to rule out all this other stuff. They literally wheeled me out of the hospital in a wheelchair to like get me out of there, and had a conversation with me in the parking lot. And they were standing so far away from me, like yelling at me, and I like could not yell talk back because I couldn't even breathe. And they were just basically like, yeah, we're sending you home. Yes, you can have the oxygen. And basically you're either going to make it in the next few weeks or you're not.
Mm-hmm.
That's it.
Wow.
That's what we've got. And if you really tank with your breathing, then come back. And like, here's the signs to come back. But honestly, unless your lungs look bad, we're not going to do anything for you. And I, being in such that fierce state, I wasn't even in a place to be like, I mean, I'm like trying not to cry right now, but I wasn't even in a place to think about like, poor me or why me or all this stuff. I just was like, what is everything I haven't done? What have I not said to my son? What have I not said to my husband? Like, what have I like not tended to? Sorry, I'm getting like super emotional, but like, I mean, I literally thought I was going to die.
Right.
And, it was once I came out of that, it was like, okay, I'm not going to die anymore. And a couple months later where I still couldn't get out of bed because I also developed POTS. So I couldn't walk to the bathroom without my heart rate hitting like, 100 and God, sometimes like, I mean, it would be like hitting like 180. Like it was super scary. I was like walking with a pulse ox all the time, wearing my Oura ring, like checking all this stuff. I was just saying to my husband, it wasn't until 6 months ago that I really started to feel like I could work out again. Like, and it has only been, in like the last 4 months that I've been able to like lift weights heavy. And so that is, and so people know I had a baby in between this time. I actually talk all about this on a YouTube video where I talk about having a baby. Is actually getting pregnant is what put my post-COVID long haulers into remission. Wow. Which is again where I say in that video, I think is because it was autoimmune. I think it was all autoimmune and we actually had no freaking clue. Yeah. We have no clue like what was actually happening in my body and a lot of people's body. But what we do know about pregnancy is because you go into more of a Th2 dominant state, it does put a lot of autoimmunity in remission. And for me, at 3 months of pregnancy to suddenly be like, oh my God, I feel amazing. Like I feel amazing. I was like, this has got to be autoimmune.
Wow. That is phenomenal. That is just really fascinating. And it's interesting because my Oura ring, when I walk up the steps, it asks me if I just did a workout. I'm like, no, I did not just do a workout. Like my heart rate is, accelerating so much. So POTS, and then I'm also demonstrating what appear to be signs of RA triggering or flaring up in all of my joints. Yeah. And so there's just been a lot of stuff. And so the reason I asked the initial question of, what did this do to you as a practitioner and your confidence level and being able to get out there and support others? Because for myself initially, I was devastated. I felt very defeated. I felt like I have tried everything. I don't know what to do at this point. And now I'm at a phase in this journey where I recognize I've had to go through this. I've had to personally experience this so that I could, again, look outside the typical box of approaches and then be able to, focus and prioritize where my time, energy, and efforts are going to give me the biggest bang for my buck. And on top of that, it gives me a sense of empathy and understanding for what others are going through when there aren't the physical validated evidence to say, yes, this is exactly what you are experiencing. So it's very interesting. But another thing that you mentioned earlier, so I spend majority of my time serving the mental health population. And I've seen a huge influx over the last 3 years of mental health need, and specifically depression and anxiety accelerating massively over the last 3 years. And I recently attended a seminar with a neuroscientist who was describing the impact that the COVID virus is having on our olfactory center and how that is connected to the amygdala and how that is putting us into perceived stress states because we can't taste and smell to protect ourselves. So the amygdala is just firing, which is the root cause for this increased anxiety that so many people are suffering from right now. And I found that to be really interesting. So I'm curious, with that being taken into consideration, how is that playing a role on progesterone? Being able to maintain and support progesterone naturally?
Yeah. Okay. So I actually am very interested in that research. I have not seen any of that yet, but we do know that COVID is so contracting the virus itself does have a very negative impact on your brain health. If you know anybody who ever, I have friends who reach out to me. Anybody who reaches out to me, I'm like, take care of your mitochondria. That was the main thing I did. And when I really started to focus on mitochondrial health is when things really, like, I was able to get off oxygen. It took several months of that, but I was able to get off of oxygen. And when I say mitochondrial health, your mitochondria are most concentrated in your brain, your heart, your ovaries. Like these are some of the main tissues that they're concentrated in. So yes, there's the anxiety component. There's also the brain fog that comes up. Brain fog, a lot of these symptoms altogether can create a panic state in the body. Now, again, if we are pushing our system into a more high cortisol state, we are going to do that at the expense of progesterone. And so the body, again, is going to shift. So, and this is where it just like really sucks because you're up with the cortisol and you're down with the progesterone, but you need progesterone to stimulate GABA. The metabolites of progesterone stimulate GABA in the brain, which gives you a sense of calm. But we don't have the progesterone. So now we're not calm. Now we're more worked up and we are having that cortisol response. Interestingly, I am not somebody who struggled with anxiety until I had COVID, and I actually had my first panic attack while I was pregnant, which is not a progesterone thing. So people always ask me like, well, don't you think your anxiety was just because progesterone was low? Not when you're pregnant. Well, if you're pregnant, progesterone is up. And yet I had my first panic attack. Interestingly, my first time with COVID, I never lost the sense of taste or smell, anything like that. I got COVID again, actually in, what was that, June of 2022. I was speaking at a conference. Everybody got COVID. My dear friend, she messaged me. She's like, you and I just had dinner and I just want you to know I just tested positive for COVID. And I was like, you are the best friend. I love this because now I know I need to quarantine, I need to test and what to expect. And sure enough, I got COVID. I spiked 103-degree fever. The fever lasted one day and I had like 2 more days of kind of feeling ick and tired and I was over it. Wow. So I just want people to know because my first time with COVID, my body was like, I don't know what I'm doing here. And it was really bad. And my second time with COVID, my body was like, I got you. Like, I know exactly what you are. And just to give people some hope around that, because my story was really scary to a lot of people. So just to understand that, like, it does, from my own experience, it doesn't always have to look the same way.
Right.
But back to your point about the anxiety component, like I said, like if your cortisol is going up, your progesterone can be going down. If your progesterone's down, you're going to feel more anxious. It can be a chicken or egg situation. Like what happened first? Was it the progesterone or was it the anxiety? And this is sometimes so in perimenopause is a great time to leverage bioidentical progesterone. You got to do it oral if you want to have the effects on sleep and on your mood. So helping with the anxiety, but because of those anovulatory cycles, the failure to make progesterone, that is something that can be really beneficial for giving that benefit of progesterone. And also recognizing that progesterone is really good for the brain. And progesterone actually helps with the myelin sheath of the brain, which is basically what protects the electrical conduction of the nerve cells and the nerve fibers, I should say. And so with that, progesterone may also be nobody's looking at it right now for COVID therapy as far as I know about, but for traumatic brain injuries, for post-concussion syndrome, it's been looked at that for helping with neuronal regeneration. I think with COVID, it's like, could it be helpful? Maybe. I'm of the we've got to study everything and kind of know everything we can about this. But as of right now, I just want to be clear to anyone listening. I can't say use progesterone therapy and that'll help with post-COVID, brain issues. We don't know. We don't know.
Right. It's really interesting when you were talking earlier and you mentioned GABA. So one of the negative consequences over the last year specifically is the decline in my mental function that is associated to when my period is getting ready to start, that week leading up to the period. I will find myself in such depressed, anxious states that suicidal ideation has started to creep in. And so a couple of weeks ago, I was in a really bad place mentally, having these suicidal ideations. I woke up on a Sunday morning and I said, okay, I need intervention and I need it now. So I went and got IV hydration therapy, and I had them infuse amino acids as well as GABA, vitamin D, extra B12, all of the stuff. And within an hour and a half, it was absolute insanity, the 180 that my mental health did. It was like literally just boom, right back to a normalized state. So for me, what I'm finding is the oral vitamins and mineral supplements are not working. I'm having to go straight to either IV or sublingual in order for it to actually get absorbed into my body and stand any kind of chance. So would taking any kind of supplement of GABA be beneficial at this point? Or do you think doing the IV hydration is the best route?
Well, the thing about taking supplements, eating all of that is that we also people say you are what you eat. In my first book, Beyond the Pill, that was my second book, actually. My last book, Beyond the Pill, I actually say you aren't what you eat, you are what you absorb. And so if you can't absorb it, then, those are situations where we might have to go another route. What's interesting, when we look at autoimmune conditions like Hashimoto's, and as things progress, is that you can actually develop autoimmunity in which you're not able to make intrinsic factor. So this is pernicious anemia. And without that, you can't absorb B12. And B12 alone, I've had patients who have reported similar things where they're like, having mood symptoms, they get B12 injections, those things turn around. Same with brain fog. And B12, we know, if you're deficient, it used to be said that if you're deficient, it leads to irreversible neurological damage. Now we know that the brain has a little more resiliency than that. So it may not be completely irreversible, but that alone can be very damaging to the brain. And so, as you say, sublingual, that is a route that many of my autoimmune patients go with B12 because sublingual is going to be better absorbed. You don't have to depend on the intrinsic factor, but also for all of us to understand that by the time the average person gets diagnosed with Hashimoto's, they already have several other autoimmune conditions. That's because once you lose tolerance to your own tissues, it's very easy for your body to lose tolerance to other tissues. And so that is something always worth looking at. And especially as you mentioned SIBO. So anytime I have a patient that has SIBO, a lot of times practitioners are like, let's just treat what's in the small intestine and keep things moving. So a couple things about SIBO. Number one is we always want to go upstream. And we want to say, okay, if you've got a problem in the small intestine, what's happening in your stomach? Where's your hydrochloric acid at? Because if you don't have adequate hydrochloric acid, you're not going to get the right secretions from the pancreas. What's going on with your gallbladder? Because bile is actually toxic to those microorganisms, which are really good when they're in your large intestine, but they're what cause SIBO, and they're not great when they're up there. And that's because they like to eat carbohydrates. And so they're going to do anything they can to get at your carbohydrates first. And we know SIBO can also cause issues. So it can break down your bile acids and make it so that you're less likely to absorb your nutrients. Your small intestine is where you're absorbing your nutrients. If anyone was seeing me, I'm like waving my fingers. The villi, these are your villi. They're there to absorb nutrients. And so with that, if you you have your gut. Yeah, exactly. So if you have small intestinal bacterial overgrowth going on, you're going to have issues absorbing nutrients. If you go upstream from that, like are we potentially having issues with hydrochloric acid production? If we go upstream from that, how well are we chewing our food? And what's going on with the oral microbiome as well? So taking a look at all of those things. Now, to take it a step further, and I actually haven't seen research on this, but COVID, for me and for a lot of people, it manifested in neurological symptoms. So the gut, I don't think we teach this enough, or maybe it's even taught at all, but like your gut, in order to move, it's your nervous system that needs to do that.
Yep.
And so there is the migrating motor complex, which I just call like the street sweeper of your gut. And at night, it should be making like 4 cycles of sweep. So getting things moving through, which is why we poop first thing in the morning. At least a lot of people do. And if that's not happening, then those little critters that live in the large intestine can make their way in the small intestine.
Mm-hmm.
We see issues with gut motility and the gut nervous system connection. If somebody has head trauma, it doesn't even have to be as severe as a traumatic brain injury. It could be a concussion, but with head trauma. So if we take a virus that is causing changes in the brain, I mean, there are studies showing us the like dementia-like symptoms. We know that with dementia, bowel sounds, those decrease in the years leading up to it. Why is that? It's the nervous system. Mm-hmm. The entire nervous system is starting to have issues. And so, there might be research out there. I haven't seen it. So if anybody can like leave it in the comments and let me know, but that, I mean, if we just know to be true that anything that's affecting the nervous system and having a negative impact on that, then that may play out in also affecting the gut. The gut and the brain are very well connected. Now, if you add on top of that, having hypothyroidism, having COVID, you're very fatigued. You're not paying attention probably so much to dry skin. You probably are losing hair. Most people lose hair post-viral illness. I lost so much hair. I was so scared.
Same.
But with all that, yeah, it's the worst. There's a lot of bad stuff about having COVID, but geez, the clumps of hair coming out in the shower, and I'm like, I'm already stressed. Like, yes. I don't need to see this right now.
Yes.
So, with all of that, I don't mean to make trivial to anyone who's lost family members or who's had long haulers as well. I'm just talking about like how, when, like, if you know, like mm-hmm. when you're losing that much hair, mm-hmm. that is not a good sign, not for your hormones, not for your health. Like
right.
Hair is energetically expensive to maintain. And if you're losing gobs of it, like things are bad.
Yeah.
Like something bad has happened.
My whole palm was coated in hair when I was in the shower. I mean, I was devastated with the amount of hair loss. And so to have rehabbed it to this point, I'm like, woo, things are heading in the right direction.
Totally. What's crazy, like my hair, I posted a video on TikTok of like getting a haircut in Paris, mm-hmm. and I had to stand to have it cut. And I've never had to do that before, but they're like, we need you to stand up. It's so long. When you brush it out, it's all the way down to my butt.
Wow.
If you go back on TikTok and you see my 2020 videos, you will see it to my shoulders and these like patches where you can like see through. And it wasn't until I went and got my hair cut and I made that little video that I was like, oh my God, my hair is actually better than it was like 10 years ago. Like when I first developed Hashimoto's, like that is astounding. But just to say to the piece of thyroid is that you may not even know you have a thyroid condition because everything thyroid actually looks like COVID or looks like any other illness. And so this is where I think like definitely screening after that 6 weeks of having COVID, just to run it, like just like if you had Epstein-Barr virus, I would want to know, did we develop an autoimmune condition? And because women and Hashimoto's, like, okay, women most commonly going to get an autoimmune condition. Hashimoto's the most common that they're going to get. And we can do so much to keep that thyroid healthy if we can intervene early. I think it's worth screening. But the gut motility piece, if the gut's not right, if it's not functioning right, if you don't have enough thyroid hormone, you're not going to make enough hydrochloric acid. Okay, again, can't absorb our B12. You're also not going to poop regularly. You're going to have constipation, slow gut motility. If you have slow gut motility, that can lead to SIBO. If you have SIBO, that can make your thyroid autoimmunity so much worse. And not to mention all of those nutrients that you need to actually build thyroid hormone, activate thyroid hormone, use it at the cellular level. That's not, if you're not absorbing it, then you won't get that. And one of the, biggest hormonal issues I see, so we talked about progesterone, and I talk about this in my book, Is This Normal? So we've got progesterone that can lead to the anxiety piece. If you've got depression and or anxiety, because like they can ride together sometimes, we have to rule out thyroid disease. And this is something that psychiatrists do very well. Psychiatrists will look at thyroid disease when there are mood issues arising, especially those that don't respond to like an SSRI or standard treatment. But not your average doctor. Your average doctor is not going to do that. And so this is very important information to understand, is if you're having sudden changes in your mood, like you're like, I did nutrient therapy and I felt so much better. Well, it could be the nutrients because yes, your brain needs all of that nutrition. It's how it makes neurotransmitters. It could be your thyroid and that you were actually able to start generating thyroid hormone. It could be, a myriad of things. And I just want people to understand it's rarely just one thing.
Right.
As I just explained, all of these things are interrelated. Just like if you don't have adequate progesterone, you actually can't use your thyroid hormone as well. Oh, but if you don't use your thyroid hormone as well, you can't ovulate and make adequate progesterone. Like, it's tricky. But that's just to say, this is where this approach usually of just like, oh, just like one diagnosis, give a medication, like it fails people. Like, is there a time and a place for medication? Absolutely. Someone who takes thyroid hormone, 100%. And yet taking thyroid hormone isn't where I stop, and it's not where I would stop with my patients. And as I explain in Is This Normal, there's a lot of things that you can do. And in fact, the majority of things that are going to help you heal and keep you out of the doctor's office are all the things you're doing at home.
Ah, man, you are such a wealth of knowledge, and your ability to articulate this very complex information into a consumer-friendly way is just unbelievable. I can only imagine what this book is going to be like and how much of a powerful tool it's going to provide for people to start at least directing themselves on the right path towards their healing. You know, when you mentioned thyroid, my frustration with thyroid and the average Western approach is that these reference ranges are so broad, and it is so difficult to get an actual diagnosis so that there can be any kind of, appropriate intervention. And I know for myself, when I originally started noticing the changes with my thyroid function, I started collecting evidence, taking pictures of the swelling ankles, the bloated belly, the hair falling out, because these were the only tools that I had ability to influence the reception I got from the doctor in terms of really taking a step back and saying, okay, let's relook at this and see where potential intervention could be beneficial. And so I started diagnosing with a very low dose of thyroid hormone, and that put me into a maintenance state, supported me for a very long time. And then boom, I'm back to this spot. So for an individual who is suspecting, okay, I'm checking all the boxes Dr. Brighten just mentioned throughout this podcast, and they suspect that there is something going on with the thyroid, who do they see to actually get the answers that they need to start taking action to get them feeling better? What do you recommend?
Yeah. Okay. So remember how I made a joke about the privilege of the American healthcare system?
Yes.
Getting a diagnosis is a privilege. In this country, getting a diagnosis is a privilege, and a privilege that's reserved only for those who have money or have the type of job that offer them health insurance. So we talk about anxiety. The United States creates a lot of anxiety in all of this. And so this is where when I see doctors really start to hate on people for self-diagnosing and being like, don't mistake your Google degree for my medical degree. And I'm like, you should really slow your roll there, because Google's the best thing that they had. Because this is the thing that I feel like so many doctors do not take into account, and it is time. The time it takes to research a doctor, to find a doctor, to make that doctor's visit, to go to that doctor, to get dismissed by that doctor, to get the wrong labs ordered by that doctor, to get told your labs are normal by that doctor when you don't feel normal, to go to the next doctor, repeat, do it all over again. That time. Or how about the time of you not feeling well? The time you'll never get back in your life. You only have so long to live on this planet. You won't get that time back with your children. You won't get that time back with your parents. You won't get that time back with your dog. You will not get that time back. And so I think we have to start having a lot more respect for the patient's story. I think that, there's that TV show House where he's like, patients lie. Patients do lie when you are a judgmental doctor who puts them into a state of shame and they feel like they cannot tell you the truth. I would lie to you because I don't want to be that uncomfortable with you. I just want to get out of that conversation with you. That's a normal human response. But the thing is that patients know their body. And the most frustrating thing is to go to a doctor who dismisses you or gaslights you. So you were saying, I write down everything. Absolutely, as you should. It's what I tell everybody to do, because it's very hard to gaslight you when you have that in front of you. And they're like, no, you're not actually that constipated. You're like, no, see, but last week I only pooped 3 times in a 7-day period. That's constipation. or your periods are not that heavy. Well, I bled for 8 days and I had to change a tampon every hour for 3 of those days. That kind of language gets a doctor's attention. And it's very unfortunate that a patient has to take on that burden of, getting their doctor's attention. But it is the current system that we're in and the system that I hope that we can change. A big reason why I write books and I speak and I do what I do is because I want to educate and empower people so they can go to their doctor more educated and have a better relationship. Not to vilify their doctor or hate on their doctor, but have a better relationship, because I have to believe at my core that nobody became a doctor unless they truly wanted to help people, because it's not a fun path in terms of how much work it is. Okay, just to be honest about that.
Right.
And it's not fun to have to deliver terrible diagnoses. There's a lot of these things that are not fun.
Right.
Okay. I'm fortunate enough that I really do enjoy my work, but I've had to structure in that way. So who do we see? Okay. Who do we see in this? So starting with your primary care doctor, or really anyone that can order your labs, to get at minimum a TSH and a free T4. That is not the full picture by any means, but that's the one that most likely your average doctor that you have access to is going to order and that your insurance is probably going to cover. That TSH, most people feel best when it's around 1. If it's creeping above 2, 2.5, we don't right away say, oh, this is a hypothyroid picture. If concomitantly we see a low T4, but it's something that we may want to retest and look at again. Certainly if your TSH is 5 or higher, yes, that is hypothyroidism.
Right.
And that's unlikely to be transient. It's when it's around that 2.5, that functional range, that I'm always like, this could be transient. However, if my patient is like, things are just bad enough in terms of like their entire symptom picture, everything going on and the labs, and it's like very clear where this is headed, then I will try them on a low dose of thyroid medication to see if it helps, because mood symptoms are not something that should be trifled with. And certainly if anyone, as you mentioned, suicidal ideation, if that is anyone who's ever experiencing that, having a mental health provider on speed dial, at the ready, when you feel well, is the best thing to do, so that you can access them when you don't feel well. You never want to find yourself in a new relationship with a new doctor when you're at your worst, because that's not a way to start a relationship, correct? So we've got the TSH, we've got the free T4. Free T4 we want to have around 1, 1.2 being most optimal. Now, most doctors will also order a TPO antibody. They will meet you with, well, it does, like, 1, they might meet you with, like, we're just going to assume it's Hashimoto's no matter what. Or 2, there's nothing we can do about it. But you can say to them, like, I just need the confirmation to understand if I have autoimmunity. And so I know if I have autoimmune disease and if autoimmunity runs in my family, right? Because if you do have children, that's a very important piece of information to pass down to them. So TPO antibodies, once they get into those double digits, that's a positive for Hashimoto's. You can have a thyroid that looks fine, so thyroid function looks fine. TPO antibodies are elevated. What is that? It is Hashimoto's, but it is not yet hypothyroidism. Hashimoto's leads to hypothyroidism. And if you are in that state, yay, let's get that in remission so you don't need thyroid medication and keep your thyroid nice and healthy, because it's only once you've destroyed enough of your thyroid. The antibodies don't do that. They flag it. Then the T cells come in. They rip it all apart and start destroying cells. And then we can't produce adequate thyroid hormone. Now, ideally, your doctor would also order a free T3, but if you're on your average doc, they're not going to do that. We want to see that around at least 3. So if you want to go to someone who takes that kind of comprehensive approach, you're going to want to see a naturopathic physician, preferably board certified in naturopathic endocrinology, or you're going to want to see a functional medicine provider. These are the doctors that are looking for the root cause, that they truly want to understand how you got there, why you're still there, how do we get you in remission, and also what's coming on the road ahead. Because it's not enough to just be like, oh, you have Hashimoto's, you have thyroid disease, like, let's intervene here. We also have to be like, but what else is coming? Like, what else do we need to be thinking about? What's in your family history? Like, what other symptoms have you had going, so that we monitor those things and so that we also come in and we start to intervene. That is true preventative medicine. And I will say, I am now seeing more conventional doctors starting to talk about lifestyle medicine, which I think is fantastic to finally hear that being more of the conventional conversation. They just started entering this conversation. So I just want people to understand that, because I've been in conversations like, It is exciting. I lecture, so I teach physicians all over the world at conferences, and I've been in conversations with doctors who are like, no, well, like I do lifestyle medicine. And when they get into really, all of it, the most they know is to tell patients to exercise and eat well, and they don't really have the tools to help you get there. That's where like dietitians are amazing, and seeing other practitioners. It really does take a healthcare team. But I want you to understand that they may not be able to give you everything you need to get there, but that kind of doctor is going to be a lot more receptive to the fact that you may want to try going gluten-free and exercising to the best of your ability and getting good sleep before you go on that thyroid medication, because your TSH is like 2.8 and you're like, I just want to try these things. And can we come back and retest in, the next 8 weeks or maybe 12 weeks? They're going to be more receptive to that kind of approach, rather than the doctors who are like, either you just take the medication or get out of here until you're so bad you do want the medication, because those doctors definitely exist.
Such fabulous information. And I think that it definitely helps individuals have an idea of how to get started on getting to the root cause and starting to feel better. You're just incredible. Your ability to articulate this is so phenomenal. So I'm curious, what are your 3 best lifestyle tips for the listener whom is potentially suffering right now with some of the things that we have discussed throughout this podcast episode? What are the best 3 places to get started in having the opportunity to heal and repair?
Sleep. If you're not sleeping right, forget it. All bets are off on anything else. So you need to be sleeping in a dark room. It needs to be cool. You need to avoid the blue light. And if that means you stay on social media, I do have patients who, so I'm always like, get off social media, get off TV an hour before bed. But I have patients that have anxiety and actually like just death scrolling, as people call it, through TikTok. That helps them just like think about anything else until they get drowsy. Please wear amber glasses while you do blue light blocking glasses. To me, I'm like, doesn't that cause more anxiety? But we got to honor what's true for them. Right. So when you wake up in the morning, light exposure. And I talk all about this in my book. Like circadian rhythm is super, super important, not just for adrenal health, but ovulation as well, and your entire cycle. So number 1 would be sleep. Number 2, I would say, I would classify nutrition as lifestyle. So making sure you're eating a nutrient dense diet and really aiming to put more plants on your plate, getting for that 25 grams of fiber, but also looking at antioxidants, things that are going to support and take care of your ovaries, your brain, all of your cells. I think that is really important. And then when it comes to number 3, there's there's so many directions that you can go with this one, but whatever it looks like for you to manage your stress. Some people got to run it off. Some people got to lift weights to move out their stress. Some people, they do well to deep breathe, to meditate, like whatever it takes for you to manage your stress is incredibly important. And I think, part of, the mental health, issues that have arose since 2020, part of that has been that we had such poor stress management techniques. Now, mind you, nobody gave you a damn playbook to the pandemic. Like that never happened before. And the fact that we all just we're here right now, I think we should definitely celebrate, even if we don't feel whole and complete and at the best that we should be. You went through the most scariest, disease outbreak of our lifetime.
Right.
And you were here. And I think that you should really be proud of that. But I think that it made it glaringly obvious as we went through all that, we didn't have good stress management techniques. We didn't have good community support. And that we were working in really toxic environments. Like a lot of my patients realize they're like, how that you were telling me, maybe my job's a problem. Like my job is a problem. And I'm like, okay. But I was like, it's a little hard thing. Like you need money. It's like how everything works. But really, I think that there's so many health gurus out there that it's like everybody needs to meditate. There's a lot of research to support that. But does meditation look like, sitting on a mat and saying Om, or does it look like maybe walking, a walking meditation, being very mindful? What are the things that don't just help you mitigate stress, but also bring you joy? Because if you're trying stress management techniques and you absolutely freaking hate it, again, you only have so much time on this planet. So can we please get more joy into our lives?
Yes, such fabulous tips. I cannot wait to get my hands on this book, Is This Normal? I have a feeling that it's going to be an incredible resource that I can share with others, as well as benefit myself as I continue on this journey that I am now, this new phase of this journey. So Dr. Brighten, where can the audience find you? How can they connect with you?
My main hub is drbrighten.com, Brighten, Brighten.com. Tons of articles and free resources all about hormones on my website. You can also follow me on TikTok, Instagram, YouTube, all at it's at Dr. Jolene Brighten. And those are the main places where I hang out. And then, of course, like your podcast. So
how do we get our hands on this book?
Is This Normal? Is anywhere you find books, it's there. And so I know most people are going to go to Amazon. You can also find it in local bookstores. So definitely, support your local bookstore. But if you're just someone that's like, I need convenience, it'll be on Amazon too.
Excellent. Well, Dr. Brighten, I cannot thank you enough for this conversation today. I feel very confident that, there was a lot of things that were discussed that are going to bring immense benefit to the listeners. So thank you so much for your time, for your expertise. And I am excited to get my hands on this book and see what more I can learn from you.
Fantastic. Well, thank you so much for the conversation today.
Oh, my pleasure. Thanks for listening to the Think Yourself Healthy podcast. Do me a favor, and if you loved this episode, please go leave a review. Reviews help make sure that this content reaches more people so that we can continue to heal as a collective. Remember to take a screenshot that you're listening and tag us on Instagram at Heather Barbieri RDN for a 15% discount on the Retrain Your Brain program. See you next time.